be talking about breathing and why that's so important. And breathing, people don't think of that like an exercise, but honestly, it has to be incorporated into your exercise. So when you experience any back pain, what happens is those muscles around your spine, they shut off, and your brain needs to connect to them again to get them to start working, bring more blood flow, circulation to the area. So in doing so, incorporating some simple breathing exercises. And as women, when we are stressed out, we tend to breathe from up here in our shoulders and our chest. So you really want to get that air all the way down into the rib cage, down into your belly when you're taking a deep inhale. So if you've taken a yoga class or you've taken Pilates before and they focus on breathing, it's really something you want to concentrate on, and concentrate on doing it correctly, because it can actually impact how your muscles recover and repair, because you're getting more blood flow, circulation down into that area, and also too, your core, or those muscles that protect your back, they are controlled by, at the top, your diaphragm, which is your breathing muscle. So if that is not working and you're instead getting all this chest breathing from up here because you're holding all this tension, then you're not going to be able to fire those muscles properly through your trunk and through your back and your abdominals. So forget any kind of stretching or core exercises. It's really not going to make that full recovery unless the whole system is working properly. So this is what we teach when we're undergoing any specific rehab exercises in the postpartum stage. Maybe you're trying to heal your abdominals after a surgery, or after diastasis recti and abdominal separation, or even pelvic floor problems like prolapse or bladder issues. We want to address the whole system, which includes your diaphragm. And so what I want you to try on your own is taking a deep inhale through your nose. And as you do that, can you feel that you're taking that inhale up here and then exhale through your mouth? Now, when we do it again, you're going to do that inhale, but I want you to imagine that your belly is actually pushing outward with that inhale. So you're getting the air all the way down lower, not up in your chest and your neck, but down into your belly. So take an inhale again. Put your hands on your stomach. Do you feel your belly expand? And then exhale. Now you may feel your belly kind of recoil. So you're going to practice that about 5 deep breaths with a good belly breath. You're feeling the belly expand on the inhale, and then when you breathe out through your mouth, then you're getting the air to expel out, and you avoid this chest breathing. So ideally, we want to get a 1/3 of your breathing from your chest, 1/3 from your rib cage, and 1/3 from the belly. So practice that. You're going to go through just some basic breathing exercises and just feel, can you get it away from your chest so much? Because that's really common. The other thing that we practice, especially as we teach Pilates here, is doing some rib cage breathing. And so your ribs, they kind of get locked down and stuck, especially if you're experiencing back pain. So we lose that ability for them to expand and get more air into your lungs. So if you place your hands on the side of your ribs, you're going to imagine like an umbrella opening and closing, and you're going to take an inhale, feeling the rib cage expand, and then exhale, blow that air out. Inhale, feel the rib cage expand, and then exhale, blow that air out. So that process is going to also be able to improve the mobility of your ribs around your back. And so if you're getting any achiness in that upper or mid back, maybe you're sitting in front of a computer a lot, this is something you can stop and take a break and just work on this rib cage breathing. So we have the belly breathing, we have the rib cage breathing, and try 5 to 10 of each of those. And you can also do them lying down with your knees bent or sitting up, however you can get the most relaxed. But it's amazing how much breathing can impact back pain. So it's one of the first things we start off on when we teach core exercises and engaging and being able to get a stronger core to help back pain, help bladder problems, because that has to do with your pelvic floor muscles at the bottom, and just be able to restore your body and get more tone in your abs and just feel stronger from the inside out.